For a long time, type 2 diabetes has been considered very much as a lifestyle disease that people can prevent. But increasingly, when I see patients, particularly South Asian patients in my NHS clinics, I see that diabetes often comes on at a very young age and when people are actually quite slim. And so one of the key findings that we've made in this study of British Bangladeshis and British Pakistanis from the Genes and Health study is actually that our population have a much stronger genetic risk than equivalent people from a white European background, and that it's that genetic risk that is driving a lot of the reason that they get diabetes at a young age and when they're slim. And working with Moneeza is really great because we've been able to unpick some really interesting findings as to why that is.
One of the main things that we've been able to do in Genes and Health through this piece of research has been to use the latest genetic methods to allow us to understand what the specific drivers of type 2 diabetes are in South Asian individuals, British Pakistanis and British Bangladeshis in particular. And by that I mean, do we have a greater risk of type 2 diabetes through a pathway of obesity, or is a greater risk of type 2 diabetes through a pathway of unfavorable fat distribution, meaning that your body mass index or BMI might be normal, but the location of where your fat is stored might be causing your type 2 diabetes. Another important pathway that we've explored and understood is playing a big role in type 2 diabetes in South Asians is something called beta cell function, and it is effectively the ability of your pancreas to keep producing insulin throughout your life course. And South Asians, it appears, greater genetic risk of running out of continued insulin production throughout their life. This drives an earlier onset of type 2 diabetes, also a greater risk of gestational diabetes because, Sarah, I mean, is that something you see in the clinic a lot?
Yeah, it is. I mean, we have very, very high rates now of gestational pregnancy diabetes, and it's the same genetic risk pretty much that causes that and type 2 diabetes in later life.
And something else that we were able to explore with Genes and Health, again due to its longitudinal linkages, is response to medication. And I think Sarah can tell you a little bit more about sort of the treatment pathways for type 2.
Yeah, so I think what's really exciting and what we really hope can come out of this research is understanding, as we've said, that everyone's diabetes is different. And at the moment, wherever you get your diabetes care, you pretty much follow the same treatment pathway. You might start with some dietary management, some exercise, then move on to a tablet, then increase up to some other tablets, then go on to some injections, perhaps insulin. But what our research shows us is that actually, according to your genetic makeup, you may respond better or worse to particular treatments. And so we really hope that over the coming years, as the NHS takes on board some genomic tools, just like you have a blood test, you may end up having a genetic test as well, that's going to point us in the direction of what are the best treatments for you as an individual with diabetes, rather than taking a one-size-fits-all approach for everybody with the condition.